Hi everyone, my name is Claire from Generation Scotland at the University of Edinburgh. And I'm going to be talking to you about public engagement that we did during the pandemic, but specifically about OurGS. So what is Generation Scotland? It is a family cohort study. We're interested in studying the genetic and environmental influences on physical and mental health. We currently have 24,000 volunteers and these are in 7,000 family groups. We recruited these volunteers between 2006 and 2011. At the time our current cohort signed up, you had to be an adult. However, in 2019 we received funding from Wellcome to double the cohort and lower the age of recruitment to 12 and over. We're asking new volunteers to complete online questionnaires. We're using remote sample collection, so we're using postal samples to get genetic and biomarker information. And we're asking our participants to consent to us using their linked health and administrative data to follow their health and wellbeing over time. So we were hoping to launch in autumn 2020 when the pandemic hit. As a team, we had to adjust to remote working and our research focus shift to COVID-19 research. The team expanded and as a result there was increased interest in public engagement. So the COVID Life projects were what halted the launch of Next Gen Scot for the moment, and they are a series of longitudinal studies to understand the psychological, social and economic impacts of COVID-19. We started with the COVID Life survey, which was a study of UK adults. We did 3 questionnaires which follow lockdown and easing of restrictions, and we adapted this questionnaire for a teen and a rural audience. And rural COVID Life is really where our remote engagement started. So in order to change the COVID Life questionnaire into a rural COVID Life questionnaire, we set up a remote PPIE group and we consulted with people living in rural communities who had expertise in tourism, business and mental health. The group was set up and delivered remotely, and a member of the team had at least 2 one-to-one calls with each member in order to build rapport and trust, and then it moved to a Zoom call as a group. And this team were absolutely crucial in helping develop the rural COVID Life questionnaire and in order to promote it within their communities so that the recruitment was a success. And we're still working with these people now because they are actually co-authors on a paper that we have published on the rural COVID Life surveys. So this was really feasibility for us to know that it is possible to engage with people living in rural communities and that they had an appetite for it. So OurGS then is a digital exhibition of our volunteers and it tells their story in their own words. It's an opportunity for the volunteers to share their perspective on what health challenges we should be investigating next. And it's also a little bit of a love letter, a little bit of a thank you to our volunteers. And most importantly, it is a demonstration that people living in rural and urban communities can take part in public engagement across Scotland. So the funding came from the Wellcome Trust Institutional Strategic Support Fund and was awarded to my colleague Rebecca Dawson. And the aim of the exhibition is to embody the diverse lifestyles and communities represented by our volunteers from both urban and rural walks of life. And we hoped it would act as a springboard for online discussions about using health data for research. So invitations were sent to around 300 volunteers. Of our 24,000 volunteers that we have, around 7,000 of those have agreed to be contacted for public engagement opportunities. So we randomly selected 20 people who said yes to public engagement, who lived in each region across Scotland, and that was so we could get a diverse spread of people living both urban and rurally, and so that it was a bit of a lottery about who we contacted and who could take part. And the photographs were taken on location, a location that was chosen by our volunteers, and they were all taken outside in order to accommodate for COVID restrictions. The interviews took part on a different day and they took place on Zoom. So I'm going to show you quite quickly some of the pictures that we managed to get. I might be biased, I think they are really beautiful, and as you can see, each picture comes with a quote that arised because of the qualitative interviews that we did. And on the last slide we have some pictures of some families which are really gorgeous. But if you would like to see the full exhibition, then please go to our website, which is on the page here, or if you can't be bothered typing all that in, then just Google Generation Scotland OurGS and it should be the second hit on Google. And here's an example of some of the online conversations that took place. So we asked our Twitter following what research matters to you most, and a resounding majority said mental health research mattered. But this is just a small snippet of some of the conversations that took part online. So what went well? Well, we did it. We managed, and we managed to engage with volunteers living across rural and urban communities. So we had volunteers in Edinburgh, Glasgow and Dundee, but we also had volunteers living on the islands and volunteers living in rural Perthshire. I think one of the key things that made this happen was that the photographer travelled to them, so that worked really well. And I think this is a really good example of hybrid public engagement, where some of it was face-to-face and some of it was online. The volunteers really enjoyed it, which we were really pleased about. I did the majority of the interviews with the volunteers, the qualitative interviews, and every single one of them said that it was out of the norm. They'd never done it before. They really enjoyed it. It was really engaging. And I think a lot of that had to do with the fact that they all had really nice weather. So it might be luck on our part because it rains quite a lot in Scotland, and we managed to dodge that. Importantly, it demonstrated that public engagement can continue throughout COVID restrictions safely. So the fact that we did this online and outside meant that everybody was safe. And it's also evidence that there still is enthusiasm for public engagement despite the pandemic, and that it is appropriate to ask people to take part in public engagement and that they're willing to do it. And it doesn't even have to be COVID related. This was about OurGS. We didn't even lift COVID. And we were very happy that we did see an increase in our social media following after we launched the exhibition, and that our volunteers did get involved in online discussions. So that all went really great. However, there were some opportunities for learning. So as I mentioned at the very start, Generation Scotland is a family health study, and on our next round of recruitment, a key demographic that we're interested in targeting are families with children aged 12 and up. So those 12 to 17-year-olds that we didn't manage to capture during our first cohort recruitment, that's who we really wanted to get pictures of now to use as materials in our next round of recruitment. However, we didn't manage to get any pictures of families aged 12 and up. We've got 2 pictures of families that were both mother and daughter. And as you could see in the photos, one of the daughters was much too young to take part. She was only a baby. So that might be a recruitment oversight on our part. As I described before, we went out to 300 volunteers, and I wonder if we could have been a little bit more brave at saying no to some of the volunteers. Perhaps we should have talked to the volunteers who wanted to take part, asked them who they would bring to the photo shoot, and then went out to another 300 volunteers and another 300 volunteers until we had more people who said that they had teenagers that they were willing to bring. So that's something that we might consider in the future. Another piece of advice that I would give is not to underestimate travel costs. So the fund that we obtained, the budget was for 3 days photography, graphic design and qualitative interview training. However, we thought that the day rate included travel expenses, but funnily enough, if you're asking someone to travel for 4 hours up north in Scotland, this is over and above the average day rate. So we had to trim or reallocate some of our funds. We had to snip from the graphic design fund, and we had to snip from our training fund in order to cover around £250 in travel expenses. So be wary of that. It was very logistically challenging to set up. If you're asking someone again to travel 4 hours up north, you want to make it worth their time. So what you don't want to do is ask someone to drive to Fort William and then down to Glasgow and then the next day go to Oban. They're all very northern, and Glasgow's in the central belt. You want to make it so that the route makes sense so that everyone's getting the most of the day. So my advice there would be that it is challenging, it is a lot of back and forth, it does take time. Just plan for that, be wary of that, and be willing to be annoying. Go back and forth a bit, say, can you make this date? Actually, the other person can't make this date, so can we try this date instead? And just planning and preparation is key for that. And the last thing I will mention is that we have ended up with some unused resources. So we asked all volunteers to complete a consent form saying that they were happy for us to use the images, and in the consent clause was that associated third parties to the University of Edinburgh could use the photos, and one of our volunteers wasn't happy with that. So we had to have a conversation with them about the use of the photos, that we would be responsible in our use of the photos. but as soon as we put them online, we had no control over them, and that they might end up on third-party websites, and there was nothing that we could do about that. And if they really, really didn't want that to happen, then we wouldn't use the photos at all, because that's the only way that we could safeguard their photos. We also had another volunteer who we sent the photos to, and they got back to us and they said, oh my God, I hate every single one of those photos. Please do not use those photos. So legally, they signed the consent form. We could use the photos, but morally and ethically, of course, we're not going to. So we now have a bank of photos that we think are gorgeous, but this volunteer does not want us to use, so we will not use. But I would encourage you, again, please go on and look at the online exhibition. There is 9 photos on there, and then we have a bank of photos that we'll use in the future that aren't on the exhibition. So thank you very much for listening. Thank you to all of my colleagues who helped with OurGS. Thank you very much to our funders, but particularly to ISSF, who funded this particular project.